When we look at where we are in terms of the HIV epidemic in the South, you cannot tell the HIV story without telling the health story of Black communities. And I couldn't do that without the resources I can access from AIDSVu.
In the simplest terms, AIDSVu is a place that people can come to get objective and high-quality information about the HIV epidemic in the United States. I was working at the Centers for Disease Control in the HIV surveillance programs. At that time, we produced paper surveillance reports, which were 100 pages of tables with tiny little numbers. I was interested in thinking, what can I do to make these data more accessible? The first time we looked at the national map, I saw things about the HIV epidemic that I hadn't understood in decades of working in surveillance.
AIDSVu is a partnership between Gilead and Emory University that was launched in 2010. We're laser focused on addressing health inequities by continuing to drive towards more and more granular data. Inequities hide in aggregate data. When we dig deeper and we look at data for subpopulations in specific parts of the country and look at cities and see disproportionately impacted zip codes, that really reveals where we need to focus our efforts.
A lot of people aren't in sort of mainstream America talking about HIV. AIDSVu is a tool that we can use to have those conversations that can lead us to better data and policy making, and also, I think, better budget decisions.
Oh, girl. All right, deck is open.
What AIDSVu has done has given advocates like myself tools that go beyond just the health message. They address race and poverty and how those things are impacting the health outcomes for different populations.
Ready? That's it. That's it.
PrEP was a revolution. We knew from the beginning that we really wanted to look at the issue of equity.
At AIDSVu, we saw this challenge and we launched the first ever state-level data on PrEP use by race ethnicity. And that data is not available anywhere else. It's transformed the ways that public health programs and policymakers think about metrics for PrEP success. It's not just about how many people are using PrEP, are the people who need PrEP the most using PrEP.
It served as a wake-up call. The data from AIDSVu really helped us see that we were leaving certain communities behind.
Black people represent 32% of the state's population, but represent 73% of all new HIV diagnoses. When we look at the utilization of PrEP being literally at the bottom, it has to be all hands on deck.
We can end the HIV epidemic, but it's gonna take resources, it's gonna take understanding, and it's also gonna take us using data so that we can make sure that we're not leaving any populations behind in this effort.
I'm so passionate about my work on AIDSVu because I see it affect real change every day. If an advocate is meeting with one of their elected officials, they have super granular data to show them, this is what the HIV epidemic looks like in your jurisdiction. These are the issues that are impacting your constituencies, and they can demand change.
We all play a role. AIDSVu gives us that solid science and research that is translated in a very community action-oriented way.
Data is power. Whether you are a mathematical person or a visual person, you can come and look and we can have a common understanding of what the HIV epidemic looks like in our city, in our state, or in the country. Our role is to make sure that there's a transparent view and to just keep shining that light.